Yeah, hello and welcome to Wimpole Street Dental Clinic. My name is Christian Mill, and in the following small presentation we would like to show you one of our cases of the month here made in our clinic. So thank you very much for watching and we hope you enjoy the video.
Yeah, hello and welcome back. I thought when I'm on it I'll just prepare another case of the month for August 2019. As always, great thanks goes to Mr. Florian Hagemoser in this case, the dental technician doing this work, and of course thanks also to the patient enduring all the pictures and videos we've taken. In this video you're going to see some surgical images, so this is nothing for the faint-hearted, so please be advised, if you can't see blood or surgical images, please refrain from watching this video. Yeah, initial situation, a normal smile I would say, but today we're not focusing on any aesthetics. Today we focus on function. And the lower left quadrant, the first molar has had to be taken out due to a root canal infection, and the adjacent teeth had insufficient crowns, that means the 7 and the 8. And we decided to go for an implant for the first molar and full ceramic. Zirconia crowns, fully anatomic, just been painted on for 3-7 and 3-8. However, we had extreme time pressure as the patient was moving to another city in Germany, and our task was to complete the entire job within 2 weeks. And everybody who knows implants normally need to heal in for at least 3 months before they can be fully loaded. So a very tricky situation indeed. As you can see, what helps us a little bit, there's a tiny open bite in the premolar and the left molar region, so we could potentially get away with only light contact on the implant after placing the final restoration. However, we planned within one visit the operation planning, determining the implant diameter and length and which system to use, preparation of the 7th and 8th tooth in the lower jaw left of the both molars in the back, placing the implant and taking the impression of that as well. And in this case, really the digital impression really helps. But let's get on with it. That's the situation from the side. So planned is one session. D is the CBCT, implant planning, preparation, impression of 7-8, implant placement 3-6, and impression of that as well. And 2 weeks later, place a final situation. We always start with the photographic documentation, taking the color with and without pole filter, and we use a gray card kind of thing now to have the laboratory determine exactly the color what we need, and just later on that leads to really fantastic results. Then taking the CBCT, and you can see already we're a little bit in trouble because the buccal bone is missing. However, we are brave and still go ahead with the implant placement and the bone augmentation and the impression all simultaneously. So you can see here, this is the initial scan of the situation. We scan the lower jaw and the upper jaw. I always start with scanning the long-term temporary. Here in this case, why do I do it? I do it because I want to make sure that the bite is more or less correct, and the more information the software has, the algorithm has, the more likely the bite is going to succeed. As we'll see later on, it wasn't quite right still, but close enough so that only small corrections were necessary to correct the bite. You can see as well, one thing I really don't like is the calculus, the build-up on the lower front teeth. We have not been able to schedule a dental hygiene because the time pressure in her schedule was so tight, and we didn't have an appointment for dental hygiene available. It is a little bit silly, I might say, to show such a case, but what can you do? We just cleaned proximal, the distal end of the lower left premolar, but that was basically it. So I apologize for the build-up in the lower jaw. It's a little bit terrible, but like I said, we've been under so immense time pressure, and I still want to show this case to let you see what's possible. Of course, she had the teeth cleaned later on but in this stage it was just not possible. So I apologize for the build-up. So taking the impression of the upper jaw, taking the impression of the lower jaw, and then taking the impression of the bite. As you see here, it's always important in the frontal region to have like a waving technique to prevent any major distortion of the models and have a certain trueness to it. So an upper jaw is always much easier to scan, as we don't have a tongue which is round, and the only difficult area is the back end of the second or third molars, because we have the muscular putative areas lateralis and medialis who are a little bit in the way, and but normally you can get around that when the patient just moves to either side. So you can see here the scan nearly completed, runs quite smoothly. I know the companies tell you can do a scan like in 26 seconds or 27 seconds, whatever you see on YouTube. That's not entirely accurate. For an entire upper jaw and lower scan, you'll need your 5 to 6 minutes overall. So having a scan completed within 2 minutes is just not very accurate. You need perfect conditions for that. So taking the bite, take one bite on the left side, take one bite on the right side. Here, this is the bite on the left side. I always take a few pictures more to give the algorithm as many informations as possible. Even take some pictures of the front teeth, especially where they bite together, and you see the bite is always the most difficult thing for these digital models, and a lot of times you have to rescan the situation when you give it to the technician. So always checking, was the bite correct? Apologies again for the build-up in the lower jaw front. Like I said, it was removed later on, but like I said, on the day when she came, we had to act now and then to get things done. So next step would then be that we start with the preparation of the teeth and doing the fillings. That was exactly what we did. I wouldn't take the impression at this stage yet. We always place a 000 cord first, then do the preparation, then place another 000 cord. But in this situation, as extraction, all that was quite recent. Everything taken off the crowns and all that was done on one day. It is very, very difficult to achieve absolute dryness, which is necessary for every scan you undertake. So we placed additionally X-Pazul right before the impression, which can't be seen here, and left it for 5 minutes so that they became proper impressions. So here you can see the impressions of the prepared teeth, and you can see actually works quite well. And as this is a basis for the dental technician to really do his good work, you can see that worked well. We have a small missing part on the wisdom tooth, mesially, but that can be dealt with easily, and that's what we did as well. But it's all dry. The preparation margins are visible, so we can go ahead with the implant. So here we go with the surgical images. Remove the gum from the underlying bone, and you can see the buccal part is missing, but that's not scaring us. We have actually a 3-walled, or if you count the bottom, the 4-walled defect, so no problem. We place the implant, in this case a Camlock, the new line, the progressive line, which is a fantastic implant, very forgiving, still aggressive but not as aggressive as for example Noble Active implants. So it's fantastic implants. And place the scan body directly on top. Do the bone augmentation, fill all the gaps between implants and the residual host bone, close it with a membrane, and then we're ready for the scan again. And you can see it's not bleeding anymore, it's as clean as it gets environment. The software has a little bit of problem because it expects the prepared tooth, but instead it sees the long-term temporary, so it's a little bit confused there. That's why you can see the frame getting red at times. But if you're a little bit patient, you and the software both will get used to the situation, and you can actually take a quite accurate impression of the implant position. Of course, then it's important when the technician starts its work that you discuss with him the emergence profile as to how exactly to get that done. So, scan's done. Then we change the scan body to a healing cap. And that's the digital model. And you can see it's been a quite accurate impression. position of the implant is great. We didn't have any problems with the contacts in between the teeth. So, and this is all full anatomic, full ceramic zirconia, just been painted. And I think it's quite a terrific work. So credit to Florian Hagemoser here. He's done a really, really good job. One thing which wasn't quite right was a bite, which happens with his digital impressions time and again. So we just had to retake a small bite, give it back to the laboratory, and after 1 hour we've been finished with the bite. And this is the final situation after basically 1.5 weeks after we placed the implant in the bone augmentation. You can still see where we did the vertical incision, and but I think it's a rather pleasing work for the time frame we had to finish it. So I'm happy with it. The patient was happy and worked out well. She didn't have any inflammation or anything, and I'm really, really excited to see what happens within the next half year, how the implants get stabilized, how the bone stabilizes, where does the bone grow to, does it go to the first thread, does it stay there? I mean, of course, it's a platform switch implant, so let's see. This is the x-ray after we've taken that, so everything, of course, naturally fits perfectly. And like I said, I'm really excited to see where the bone in the end will be. So yeah, I'll give you an update maybe in 5 to 10 years to see if these cases are successful after a long time. Yeah, as always, thank you very, very much for your kind attention. I hope you enjoyed the case, and yeah, let's see what we can do in the future and bring you other exciting and, in my opinion, very, very interesting cases, and continue to lead the way in immediate implant placement. Thank you very much for your kind attention. Yeah, and have a lovely day. Thank you.